Right, hi everyone. It's a pleasure to be here today. So, I'm Saumya Barber. I head up Proposition Development at Unum. And thanks for joining me for today's session. A quick little bit about me and my background. I've been at Unum for about 10 years and have had various roles across our sort of claims, rehabilitation and proposition areas. But prior to that, about 20 years ago now, I started my career in health as an occupational therapist and then went on to specialise in workplace health, both taking roles in HR teams and also consulting roles across organisations like EML and KPMG. So spanning quite a number of years. So I feel really lucky to do what I do and also work for an organisation that really lets me drive my passion for health and wellbeing, but really importantly making sure that we really create quality solutions that make a difference to people as we sort of strive to help more and more people. So today I thought I'd spend a little bit of time talking about the changing landscape of health and what we need to consider when we're adapting and applying different solutions, the importance and the power of the data that we're building up at our fingertips, which leads us to the importance of that employee experience and how we can really drive engagement to make impact on people early, which we absolutely know is critical to getting good outcomes. Finally, I'll briefly discuss how all of this flows through to the workplace in terms of wellbeing strategies, and hopefully we'll have a couple of minutes to take some questions and answers. So, let's begin with just exploring some important trends and developments in healthcare and the landscape in the UK. Starting with, I guess, the sadly continuing pressure on the NHS. More patients than ever are waiting for appointments and treatment. In fact, there are record high numbers, currently 7.3 million people in the UK who are waiting for treatment. And this is creating and compounding a backlog that's going to take us years to clear. And we know that waiting for appointments impacts productivity and work, but obviously also mental health. And that's a really difficult place to be when we know that early intervention is really key to positive and sustainable health outcomes. Linked to this is the continuing deterioration on mental health, with more and more adults reporting increased levels of mental distress, and that's now increased from 21% to 25%. And we're seeing this trend in our own data from our mental health support that we offer through Help at Hand, our employee health and wellbeing app, where the utilisation continues to rise month on month. And we see that 62% of mental health consultations are for depression and anxiety, and a further 15% for stress. Again, a really important area where we know that early intervention is really key to getting sustainable results. The last two areas I wanted to really briefly touch on was musculoskeletal issues, which continues to be a key reason for absence or days lost in the workplace, and also, sadly, cancer prevalence. With the number of people with cancer estimated to be 4 million by 2030, which has dramatically increased from the 3 million that were recorded in just 2020. And the more worrying stat here is that there's a 93% appointment target for patients to be seen by a specialist consultant within 2 weeks of an urgent GP referral when there is suspected cancer. And that target has not been met since May 2020. So again, really worrying when early detection and treatment dramatically changes the outcome for an individual. We can obviously talk about these issues in silos, but we absolutely know that they interact, and we can appreciate where having things like long-term pain is of course going to mean that you're more likely to develop a secondary issue around things like mental health and things like depression if you're not able to carry on with your life as you were doing otherwise. So how these environmental factors play out across these key health areas are absolutely critical for us to understand and then address. Separate to the health areas I've just touched on, there's, I guess, a broader, constantly evolving and changing landscape that we're in. Firstly, hybrid working and a post-pandemic world continues to be a topic that employers and employees are trying to navigate. The pandemic has not only impacted the health of the UK, but it's more broadly impacted the way we all live and work. And it's really important to understand how that impacts employee populations across age, gender, income demographic, work. And I think all of those things mean that we have to be able to provide adaptable health and wellbeing support that's really meaningful to those groups. The other big headline that sadly isn't going away is the cost of living crisis, and an important issue that we're having to navigate and support people through. And inevitably, we know that financial stress has a negative impact on mental health and vice versa. And again here, a really preventative approach centred around education and personalisation is really important to help people manage before it becomes a really big, all-consuming issue. So I guess with all of these recent difficult growing issues, the workplace becomes that really key gateway to connect people with meaningful solutions and support them in a way that really makes a difference to them. And employers are continuing to take more and more responsibility for the health and wellbeing of their employees, which we obviously know isn't just good for people and society, but for business more holistically. So I guess as we start to think about meaningful and impactful solutions, we know there's been a huge increase in digitised services, and it's a crowded space, and it's been pushing on at pace because of the pandemic and now ongoing hybrid working, which has only accelerated our acceptance for using these types of solutions. Digitised services from remote access to medical experts to digitally enabled therapies, wearable tech from tracking steps, wearable tech tracking AI, have all become hugely popular. And this continued rise in adoption and acceptance of digitally supported healthcare is fantastic because it gives us a platform for driving higher engagement for employees. And as I said earlier, to make that really meaningful impact to them and often extends to their families too. But it's not without challenges, and we need to consider that sort of flip side, which is knowing what to use, which can be overwhelming. You know, what's a fad, what's light touch, and what's going to actually make a sustainable difference to people. And I'm going to touch on that a little bit later. But this does bring me to how we use insight to personalise and then predict health and wellbeing needs. But what does this actually mean, and how is this helping us progress and actually become more sophisticated when we try and target solutions? So when we develop our own health and wellbeing propositions, we take a really broad view on the macro factors in the UK, as well as the individual needs through big data. And these are large data sets from what we see in the NHS, the UK job market, increase in digital enablement, needs and expectations from employees that we hear directly from working with customers and so on. But we use all of this to really carefully consider the impactful health and wellbeing support we can offer on a large scale. But then we can feel really confident that it's meeting the growing needs of the population. And once we've put these solutions in place, that's when we then have the opportunity to use predictive analytics. And we can take that available data and then extrapolate it over the coming months and years so that we can identify usage trends as they start to emerge. But I wanted to bring this to life with an example from our app Help at Hand. And we work really closely with our third parties at Square Health to review usage trends and then predict future demand so we can accommodate any increase or emerging needs very early. So if we zoom in on remote physiotherapy, given the persistent issue on musculoskeletal issues. Physiotherapy is traditionally viewed as a more sort of hands-on physical therapy that you use when you have an injury. But what we've seen in our service is that this has been flipped on its head with the use of digital physiotherapy early to help get to people quickly without them having to wait long waiting times or triage, etc., which we know is a growing problem post-pandemic due to backlogs. So there's an increased acceptance in using these sort of digital modalities, but you couple that with a really leading customer experience, and that's been really key to the success that we've seen. A recent study also of over 27,000 physiotherapy appointments proved that digital physiotherapy was just as effective as in-person. So that sort of increased acceptance that we're seeing is a really powerful way to impact musculoskeletal issues early, and our data is backing that up. So in the year end to April 2022, those who received treatment, 97% of users were offered an appointment within 2 days. So amazing for early intervention. Additionally, 95% of employees who used the service said that the clinician fully dealt with their concerns during their sessions. So there was absolutely no compromise on quality or outcomes because it was through this personalised, clinician-led model, but it was enabled through this fantastic health technology. So I guess in summary on that sort of part is that we're seeing these exceptional outcomes in a really key health area, but it's being achieved through easy, seamless journeys for that end user, which typically meets, if not exceeds, their expectations, but it really gives them choice and control. So linked to this, one of our large clients who launched the service publicly reported that they saw a reduction of 18.1% in time off for medical appointments after they rolled out the service, which I think, again, really proves the way that digital health solutions can really break down barriers in terms of access and early intervention really, really powerfully. So the next area I just wanted to briefly touch on was that digital healthcare piece and how it is transforming the employee experience. And I've alluded to it, but all of these advancements only mean something if individuals engage in it and it makes a really meaningful difference to them. So if we think about the reasons that people stay and choose employers, research shows that 40% of employees who think about leaving would do so for a better benefits package. But we also know that health and wellbeing services are going higher up on the list of what's important to us. So I think what's critical here is that digital healthcare gives individuals a really powerful health and wellbeing ecosystem at their fingertips on demand. And often, again, as I said, it extends to not just them, but to their families, which has tremendous value. And at Unum, we've made a really significant enhancement to our employee proposition by creating a single employee app that we think employees will come to regularly to proactively look after their health and wellbeing support, because we know some of the things we've just talked about, clinical services are really critical and they're valued, so things like mental health and physiotherapy, but you generally only use them when something has gone wrong or not going so well. So we've ensured now that, I guess, employee experience is at the heart of what we've developed, alongside some addition of really key preventative services, including coaching, nutritional support, personal training, all of which is one-to-one with experts, but enabled through video technology. So we're really empowering employees so that they're really ready to engage and then just take control of their health and wellbeing. So when we talk about employee experience, I think navigation here is really, really important, and it shouldn't be overlooked. It can be really daunting and confusing to know where to go for what. So things like digital health and wellbeing assessments can be a really powerful way to empower people, but then target them to personalise solutions. Again, something where we can use digital capability to unlock that. And that's where actually this is allowing us to build brilliant customer journeys and remove barriers to great health support, all being served to people from anywhere in the world, all in one place. So this is, I guess, how we begin to really impact people in their everyday life. I've just got this quote up here because I think this always brings it to life for me. I'm just going to read it out loud. So this is one of a customer who's used our service. So help at hand can be literally life-saving or a valuable backup if you just needed a chat or some advice. It's an incredible perk, and I wanted to say thank you for all those involved in making this part of the employment package. Being completely honest, I would not be writing this if I hadn't used it. So I think that last bit there is something that we always reflect on when we're thinking about how we're going to innovate and take our offerings to the next level. And digital is absolutely an enabler to that kind of impact. And we know in our own service that more than 1/3 of appointments are conducted out of hours. So again, the workplace is that gateway to them having that, and it creates tremendous value and meaning to that individual's health and wellbeing. I guess we need to be developing these intuitive and digital solutions with no compromise on depth or impact, and that's what that sort of quote I just shared connects us to. The final area I am going to briefly touch on is how does this impact business and what should employers be doing? So employers need to really be looking at what their workforce not just use today, but what they're going to need for tomorrow. And we can all do this by digesting the data that we have, but also consider that sort of bigger picture that we discussed earlier. And from a pure business sense, all of this delivers benefits, and I'm sure we're all familiar with that in terms of reduction in absence, increased productivity, retaining the right staff. However, realising these benefits tangibly takes regular review. And what we do, as an example, is we provide a really comprehensive report to employers who've launched our solution, whilst obviously completely maintaining confidentiality as top priority. But from overall usage data, we can glean really important insights. And for employers, they can identify trends specific to their business and then work to make really targeted changes. And I guess the workplace then becomes that vehicle to connect people with innovative and preventative solutions. As a whole, I think employers should be really, really confident about asking for this level of detail and really pushing their partners and providers to demonstrate impact and outcomes. And we know this is really valuable on an anecdotal level when people do engage, but it's really essential that businesses see the value in their investment and that they're connecting providers to drive that sort of total health and wellbeing experience. So I guess with that, I'm just going to pause and summarise, I think, what I think are the three sort of takeaways centred around what I've covered today. So firstly, it's really a focus on outcomes and quality. Secondly, considering using digital to really enable this connected employee experience and serving it up to them at their fingertips. And finally, the use of data, not just macro, but also the micro, in the decisions around wellbeing as a whole, to really challenge partners to support you with this when you're considering what you're going to offer your workforce. So with that, thank you for joining me today, but I'll open up for any questions or thoughts.